The following ShishMed podcast is a production of drpodcasting.com.
This is a special podcast produced on site at the ShishMed Connections 2021 Annual Conference in San Antonio, as we talk with keynote speakers and session leaders direct from the show floor. And with me is Julie Vandersloot, Marketing and Creative Services Manager at St. Charles Health System. Her session, Spark Inspiration, how St. Charles uses videos for next-level employee engagement. That's very interesting. Julie, welcome to the podcast. Thank you for stopping by our podcast booth. We appreciate it. So you created the St. Charles Sparks program to help with employee engagement. Tell us about that.
Well, we're in communications and marketing, so our job is to connect with our employees, who we call caregivers, and we have all the normal channels, e-newsletters and, different types of posters and announcements and forums, but we weren't seeing results. And we came up with the Sparks program. We partnered with Vidler, an engagement platform, to reach those employees, specifically frontline employees. They're doing their jobs, they're caring for patients, they're not checking their email. So we knew we needed to do something a little unique and different to kind of get their attention. So Sparks was born.
And that's primarily a video program. That's what you thought. This is how we're going to make this work, is
video. So the way the platform works is that we roll out our video messages. We do 2 to 3 a month. And employees watch the videos and get points for not only watching the videos, but also certain videos that we want to share externally. We give them points for sharing on their social networks. And then they can, in turn, cash in those points to get St. Charles branded gear.
Okay. And what did they do with the branded gear? What happened?
Well, they wear it, they use it, We have all sorts of stuff. We make sure to add some high-end items that people can save for and be really proud to purchase, so to speak. We've got North Face jackets and handmade mugs, and people have been really, really excited about the things that we've chosen to put in the Sparks store.
Yeah, so what are some of the messages that you include in these videos to keep them engaged and motivated and uplifted in a really difficult time?
You touched on it, a difficult time. So a lot of what we've put out there is around COVID, around what's happening in our hospitals. Like I said, frontline employees get in this kind of microcosm of care. They're about their departments, they're about the patients. They aren't necessarily looking beyond what's going on right there, and that's okay. But what Sparks does is we can reach them and help inform them and encourage. A lot of our videos, we have some thank you messages to our healthcare frontline and support teams, so we just use that to inform and engage them.
So what have the results been? Have people felt more connected and has there been more gratitude and they feel like, hey, the hospital appreciates me more?
Yes, we've definitely seen that. So numbers results, we've had 90% engagement over the first 8 months that we have had the program live. We've only been live for just under a year with it. And some of the anecdotal results, our videographer will go on a floor to shoot, and before it was kind of convincing them, like, this is who I am, this is what I'm doing. And now he shows up with a camera and they're like, is this for a Sparks video? We say yes, and he's invited in. They instantly connect with him, and it opens up better interviews, as you probably, you're in that world, but more authentic. There's a connection there, whereas before he was trying to kind of pull things out of them.
So they're a lot more receptive to it.
Yes.
Wow, this is really interesting. So you've done all these videos. You've had to have learned what moves the needle when it comes to content. So can you share some tips on content building for us?
Yeah, so we have an intern, but we have dedicated resources on our team. I think that's really, really important. We have invested in some pretty quality equipment, and that makes a big difference. We would always advise people to do that. And then the relationships. So not only with, having a recognized program, he's also worked really hard at developing relationships with our caregivers. So that opens the door in many ways too. To commit to a quality product, but also we say on our team just to ship it sometimes. Sometimes you just have to get the content out. There's a blurry picture, or maybe the sound was off and there was, something distracting, but you're going to reach way fewer people if you don't ship it on time than if you just get it out there. So don't be too much of a perfectionist.
Yeah, so in the podcast world, we always get questions. What do you know what to talk about? How long should it be? So how long are these videos generally?
Generally, we keep them to about a minute, minute and a half. They're pretty short, keep people's attention.
So easy to watch.
Yes.
You're not asking a lot of them to watch a minute and a half video.
Right. Yeah.
Okay. And what about content? How do you come up with topics or subjects? How do you do that?
I mean, like I said, COVID, it's kind of just come up on its own, unfortunately. But some of the other things we talk about, we really focus on stories. Because, with the Sparks program, it has been popular and every department wants a video. And so the first thing we ask them is, do you have a story? We are not going to make a training video or an informational type video without that story piece. So that's what we focus on.
Yeah. Okay. So this has been great, Julie. So anything else you'd like to add when it comes to employee engagement and what you've done there?
I would just say, don't be afraid to have fun. Our caregivers, especially, obviously in healthcare, are dealing with some serious things every day, and they need to be able to unwind, and it's just been so fun. It's been fun to hear their reactions, and they get involved, and they go into the store, and they get fun stuff, and I mean, just don't be afraid to have a little levity. They love the game part of it, the gamification and getting points, and don't be too serious to try something fun to engage your employees.
Yeah, well, it sounds like you've gotten a lot out of this, too. It sounds like it's been very satisfying to you to put this program together and see the results and see them uplifted.
Yeah, absolutely. And we launched, in October of last year, so we were still kind of in the middle of the pandemic, and we weren't sure if that was going to be well received or not. And it turns out it was one of the best things that we could do for our employees who were tired and still tired.
Right, and letting them know that they are appreciated really sounds like it has helped them a lot. Well, Julie, this has been great. Thank you so much for your time. We appreciate it.
Absolutely. Thank you.
And sign up for the SHSMD Connections virtual conference, October 19th through the 21st, 2021, which will feature 2 days of new sessions plus recordings from the in-person event. Go to shsmed.org/education/annual conference to learn more and to get registered. And please join us at next year's conference, SHSMD Connections 2022, September 11th through the 14th at Gaylord National Resort and Convention Center in National Harbor, Maryland, outside of Washington, D.C. And if you found this podcast helpful, please share it on your social channels. And to access our full podcast library for other topics of interest to you, visit shsmed.org/podcasts. I'm Bill Klaproth. As always, thanks for listening.